Hello, and thanks so much for joining us. I'm Carol Jenkins. The program is Black America, and my guest today is Jonnel Doris, former senior advisor to Mayor Bill de Blasio. In 2020, Mayor de Blasio appointed him as commissioner of the city's Department of Small Business Services, and he now serves as the CEO of START Treatment and Recovery Centers. And thank you so much, Jonnel, for being with us.
Thank you. It's great to be here.
Right, and thank you for getting us through the pandemic. You know, we saw a lot of you helping us all manage that.
Yeah, what an experience, right, for all of us. I think we're all still sort of thinking about that, right, that time and the challenges that were there. Yeah, the struggle that, you know, most Americans were facing at the time.
Right.
Certainly our city, which was certainly under siege from the pandemic.
Right, right. And so you were working in small business, and you're also an entrepreneur as well. And
Yeah.
you know, I mean, but now we're here today. I said,
Yeah.
can we talk about START? And you said, sure.
Yeah, absolutely, absolutely, absolutely.
So it's a recovery and treatment program based in Brooklyn and one of the largest in the country in terms of mental health and post-addiction services.
Yeah.
Give us the history of it.
Yeah, sure. So again, thanks for having me on. And, you know, it's always great to talk about sort of the real challenges our community is facing today. You know, 55 years ago, a renowned doctor, Dr. Benny Prim, was working in Harlem Hospital as an anesthesiologist. And he saw at the time soldiers coming home from Vietnam. And he was moved with, you know, the addiction and challenges that mental health and addiction challenges and the reentry back into the country that many black soldiers were dealing with. He himself being a former soldier as well. And he said, I've got to do something about this. And so he sort of ventured out and started ARTC addiction services that he wanted to you know, provide to our communities, which at the time, as you can imagine, was sort of not a popular thing, right?
Right.
And so he started this organization, Addiction Research and Treatment Corporation, which then a few years ago changed to START. And so we provide a series of supports for those who are going through mental health or addiction challenges, also general health, primary care services we provide. And on top of all of that, the specialty care, HIV/AIDS, which hopefully we can talk a little bit more about, we also have a research arm. We do significant research in the spaces of mental health, trauma, HIV/AIDS, Hep C, et cetera. So it's a very comprehensive organization, which, you know, I think, you know, we're proud to say, you know, the largest black-founded organization and led organization and oldest in the country doing the work that we're doing.
And how many thousands per year clients do you have?
Yeah, you know, right now we serve about 3,000 to 4,000, you know, participants who are in our programs. You know, it depends on the year, but certainly now we've seen sort of an increase in influx of challenges post-pandemic, right? We're seeing all across America, and particularly in New York City, the challenges that our community is faced with post-pandemic.
And what mental health and addiction, but what do you think is driving that?
Well, there's so many factors. You know, when I came to START, one of the things that we didn't have as an organization was a psychiatry department. And so we have now added a psychiatry department, even though we had psychiatrists working with us off and on. Now we have a full-fledged department to address the mental health needs our communities are facing post-pandemic. During the pandemic, you can imagine, you know, the anxiety, the depression, being, you know, away from others, you know, the poverty, you know, unemployment. When I was commissioner, one of the things we saw immediately that was really telling, I think, of what's to come is that we went from a 4% unemployment rate to 20 in a matter of months. So a million people out of work, right, in the city of New York. significant portion of them being Black Americans and people of color in general. And so, because the types of work that we did was, involved people.
Sure.
And so we had to social distance and be away from folks. So we saw those industries being greatly affected. So I think that's part of it, sort of just a natural bend. And then also we saw that, there's some significant, how should I say this, within our communities, a lot of these issues were never really addressed.
Right.
Right. And that's a huge part of the challenge that we saw. And so now we're seeing the effects of a lot of untreated community members, the stigma that's associated with mental health and substance use, and also health challenges. We saw it through the HIV crisis and other challenges that we're seeing.
And where is that now, the HIV crisis? Has it flattened out, or are you seeing rises?
Well, we're seeing, spikes in certain communities. Certainly in the substance use community, we are, really monitoring that because it's part of our charter. We sort of spent a lot of time with Dr. Prim and our organization at the center of the HIV crisis, bringing hope and help to communities, Black communities in particular. For instance, our founder was one of the architects of the law that was passed through the Bill Clinton time with Maxine Waters.
Yeah.
Is the architect to bring those hundreds of millions of dollars into Black communities for treatment, recovery, et cetera. So this is at our core. And we're seeing, we're not concerned because as we were before, but there is certainly some activity there that needs to be, looked at, particularly within our communities when it comes to substance use. And we're seeing in other places some uptick in HIV cases. Obviously, there's treatment for it. Folks can actually live now and live fulfilled lives, et cetera. But we do monitor, our infection rates, et cetera.
Women and men?
Both women and men.
And I was noticing on your website that you are doing a lot of work with adolescents now, 12, 13?
Yeah, and I always pause at this because, I'm a father of two. My daughter is in 8th grade. This was the first day of school for them.
I know. I'm a grandmother of 2 of them that went off today, right? Yeah.
And then my son is 11, so 12 and 11. And, she's about to go to high school next year. And 1 in 10 high schoolers in New York City, 320,000, said in the last 12 months that they attempted suicide. Now this is, as a parent, as a father, as a minister, as a community member, it's shocking. That's 36,000 young people to some degree. If you think about the numbers,
sure.
It is heart-wrenching. So, we know that this is a challenge, and we want to make sure that we address this issue. So we do have a mental health clinic. In the state's term, it's called Article 31. Let's get into that jargon.
Article 31?
Yeah, let's get into that jargon. But it is a certified clinic with the state where we provide mental health services to young people that are 12 to 17 years old. And we give them supports with child psychiatrists. We have mental health specialists, social workers to work with them and their families to help support them in their journey.
And you said that you would like to go even earlier. The 12 is not soon enough to actually stop this trajectory.
And we know that, a lot of untreated and unmet needs that are out there with young people coming, who are in elementary school, again, because of the challenges, what we call the social determinants of health in particular, that are not being addressed, that, it sort of propels an individual to a certain place, all right? And if we can go upstream, if we can provide more support and help to young people upstream, we know that it works. We know that once we engage them at an early age, that we'll see better results. So hopefully, and God willing, that they're not in our other types of programs, right? If we can get to them and their families earlier, to give the support, to give the treatment, both clinical and community focused, I believe that we'll be able to see sort of the change for what we're seeing now, which again, one in 10 are thinking and contemplating suicide, and that is just troubling.
We talk about social media as one of the causes for this when we're talking about our children. Is poverty an issue as well? What else is working? I mean, the fracture of families. What are they dealing with?
Yeah, it's a combination of things. I think the most pressing and I guess most visible, if you may, at the moment is social media. And, speaking to young people and seeing even my own children and seeing, if you don't monitor, and even if you try to monitor, right, there's so much happening there that's beyond our control as parents, that you're seeing young people being affected by social media. And then there's the broader issues, such as what we call, again, the social determinants of health. And the four we start looking to focus on is housing is the number one issue.
Right.
Number one issue.
Housing.
You can't be well if your housing is not well. I'm sorry. We see the correlation in every area of life. Housing is number one challenge. And as you know, in the city, this is a huge priority, a challenge across the board with folks getting decent housing, stable housing, suitable housing, and affordable housing for them.
And we do know about all of the children who are living in shelters. When I go to the website, it's 20, 30, 40,000 kids who are in public school systems and et cetera. So
housing is critical, and how do we provide supports to those families in shelters as well, right? And so our population, adult population that we serve, significant portion, 30 to 40% at any given time, has a housing challenge, either homeless or in a volatile situation or the like. I mean, that's significant. That's 1,000 people and over we're serving every single day that are coming out of these circumstances. Got to do something there, right? And then second, broad social determinant of health that we see that is driving a lot of these indicators is economic viability. One individual ability to, as I put it, meet their full potential when it comes to their contribution back to society in the form of their work or their economics, and then that also ultimately impact their education, which is so critical, right? Because you need to be educated in order to get good work, and even if it's skilled work or not skilled work or high school or or whatever it may be, education is at the center of that, and economics impact education. And we see that. So we're seeing, again, a lot of the mobility is challenged because
how do you deal with all of those things, though?
Yeah.
I mean, they come to you for an appointment, for medication, for talking to the therapist, whatever, and then they go back out with, to the same situation. I mean, I know that you are working on giving them leads of housing and all of that. Tell us how that works, because we know that you don't turn anybody away.
Cannot,
no matter what the ability to pay for these services.
Correct. And so, I think the beautiful thing about being a trusted party in a community is that people come to you. And when they come to you, it is our obligation to find solutions for them. So for instance, on the housing side, again, we work with housing organizations to support our community. On the job side, if you come to one, if you're a part of a START program, you are assessed by a master's level vocational specialist. That vocational specialist then will get you connected to a program, either a training program, educational program, any type of program, based on your ability, obviously where you are in your journey, recovery journey, where you are mentally, we assess, but we connect. We also do some training in-house. So we have in every one of our sites the ability to do what we call vocational training. So if you think, for an example, last year, so 3,400 people in our program, about 1,000 of them went through this program at some sort of level. So, you know, there are many levels to it. Out of that, we had over 300 jobs full-time. Now, full-time jobs is in 90 days, people are working and consistently still working, right? And so every year we have this. And to me, that's one of the best parts of our program. Folks come in, they get trained, they get connected to jobs, real jobs, and that is sustainable, right, to transform their lives. But as you can imagine, we stay with them, right, because they're not out of the program.
Right.
They're with us.
Right.
And so we have to be there. How do you deal with money now that you're working, right? How do you sort of deal with all the challenges that come with actually being on a job and needing the support of others to make sure that you succeed? And so we are there, our counselors are there, walking with them through the process. And I think that is the unique sort of approach to this, is that we say, come get job training and then we'll go out and do it.
Right.
No, we're saying, wait a minute. We also want to make sure that you are supported and helped throughout your journey.
Well, the work you're doing is, you know, just tremendous, you know.
Thank you.
One of your enemies is the quality of drugs that are coming into this city, well, in the country, you know. How has the more malignant drug, I mean, I guess one way of putting it, but, you know, fentanyl that's, you know, laced with who knows what, et cetera, and kids dying. Yeah,
you know, when you think about fentanyl in particular, you know, I pause at these times because, you know, we literally speak to our patients, our community members that are sort of dealing with these challenges. If you think about overdose rates in the city of New York, over 3,000 people died. I think over 85% or so fentanyl related. All right, so think about what that means. The majority of those who are dying of overdose are black men and brown men, 55 years to 80 years old.
Really, really.
This is a crisis.
Right.
And, you know, for us, when we talk about the opioid crisis, you know, the face of opioid crisis is not typically a black man 55 years to 85 years old.
Unbelievable.
But that's who's dying at a higher rate than anybody else in the city of New York right now. And for us, that's really the average or core participant of our program. So we are also in communities across the city where we see the high, you know, overdose deaths and challenges. That's where our sites are located. So you look Central Harlem, East Harlem, Washington Heights, East New York. We're in Bushwick. And then Fort Greene, which has a lower rate. But the challenges remains the same. The demographic is the same. And if you look at the communities in the Bronx, in Manhattan, in Brooklyn, where you see high overdoses, it's the same communities you see high poverty. The same communities you see housing challenges. The same community you see, you know, regular emergency room visits for other complications. The same communities that you're seeing such disruption all around, and same communities that you saw redlining. This is systemic. And so how do we address that? And so that's why we've made sure that whatever we're doing, it's got to be comprehensive. You're not just walking in for addiction. You're walking in for your health. Right? That's why we have doctors and nurses and psychiatrists and social workers and others working with us to connect you to opportunities, make sure that you're well enough to go out and get a job, access to care, all types of care. What are, you know, when you talk about HIV, hepatitis C, which is curable, right? But no, folks are not participating in it. Why? Because they don't know or don't have the access. So we're building all of this in to address these real issues that we're seeing. And then last thing I'll say, which is the one that moves me many times to tears, is food insecurity. Because in the wealthiest city, in the wealthiest nation, there's no reason people should be hungry.
Right.
You know, as in my life, I had the privilege of participating and starting 2 food pantries. And I can tell you, every day I take my kids to school, we pass several pantries with lines wrap around the corner.
Right.
Because of something that I think we can fix, food.
Right.
And so, you know, obviously we're working diligently with that with our population, but certainly this is a system-wide issue. And all these compounding things that we're seeing, and I hate to be so gloom and doom, but this is our reality. We need to wake up and we need to really say, what is we need a comprehensive plan to address these social determinants of need. We can do it within our program, but our program alone, you know, we need a system wide, you know, solutions, and we're getting some of that. But certainly, I think we need to educate the public a bit more about what's happening in these spaces.
So you're doing a great job of treating, you know, and as I always say about this, but what we're looking for is a way of not creating that scenario again. How do we fix that? You know, and if that is, as you're saying, essentially an economic problem in this country. You know, you've got 13 million children in this country who are living in poverty, either homeless or starvation, food insecure, et cetera. You know, so it's how do we, as you're attempting to do with reaching down to getting the 8-year-olds, you know, in your programs, how do we prevent it from happening?
Yeah, as particularly when it comes to poverty, you know, that's real work. That's systemic work. That is a diverse approach. You know, putting on my other hat as a small business commissioner, you know, when you think about the black and white wealth gap, 288 years it'll take for black people to get to where white America is when it comes to wealth. So what does that mean? You look at, okay, well, get a house. Oh, house is the best thing. Then you saw predatory lending. You have deed theft. All these things are happening. So it has to, you know, you have to be cognizant of what that is. We see wealth leaving the black community drastically. I think Citi in 2020 put out a report that $16 trillion was not added to the community, to the U.S. economy because of racism within the banking industry. I mean, so when we think about these real impacts, right? If you fund a black business, you fund black communities because they hire from black communities. You want to deal with poverty? Let's talk about black business. You want to deal with poverty? Let's talk about education within the black community and the challenges that face with even acquiring that education, about how to run a business, about supporting it. So we were proud to do the Black Entrepreneurship Program in New York City. They're growing it now and it's expanding. I'm so happy about the work that we've done there. But there's so much more to be done around sort of the economic piece to this, which obviously I'm extremely passionate about. You know, we have to make sure that black businesses are supported. Because if you support black businesses, they hire from the community. We know that poverty, but also, lastly, I'll say this, black businesses in particular face one of the biggest challenges, which is access to capital. I remember as an entrepreneur, you mentioned it before, so I'll mention it now. I said, man, I'm going to step out and go and launch my firm. And I did pretty well. And but then I said, man, I need to grow and scale. I need a loan from the bank. Went to the bank, great credit score, had clients, everything was still denied. I had to go to a CDFI, Community Financial Development Institution, which I love them, by the way. Oh, they're amazing in our communities. To get my first business loan. Okay, so when I became commissioner, and even before that, when I was senior advisor over the minority and women-owned programs for the city of New York, and created the first office to deal with that. We were very successful. You know, I think over $14 billion in contracting to minority businesses, a lot of them black-owned businesses. But when you think about what they had, number one issue, they said, Jonnel, I have a great idea. I can actually, you know, do whatever it is that they want, a restaurant, a construction, an architectural firm. They said, well, I can do it. And he said, well, what do you need? Money? Well, where do you get the money from? Well, the bank won't give it to me. And so what we developed was programs that capped interest rates and made available to New Yorkers who are minority-owned businesses and women-owned businesses to get the financing they need. And we were able to do that up to $1 million. At that time, at 3%, by the way, which is the lowest ever, we did that.
Right.
But I was able to institute a citywide policy based upon my personal experience that I went through.
Right,
And
that you knew.
And I knew. And you had to fix that in order to help these businesses support their communities and reinvest in their communities.
So we understand that you have a gala coming up, a big event.
Oh, yes. We have a gala coming up, and we're very excited about it. It will be October 24th, and it will be our 55th year. Isn't that amazing?
That's amazing.
I mean,
from a doctor at Harlem Hospital who saw what was happening to the veterans coming back and knew that there was mental health addiction, you know, challenges.
And said, we want to do something about it.
Right.
And tens of thousands of people in New York and hundreds of thousands of family members and community members impacted with the one choice that he made. And I think that's what drove me to this organization. I saw that the impact that they've made, that, you know, communities change, lives change and transform, people saved, right? And we would say, I want to be a part of that. And so we're celebrating 55 years. It's going to be amazing. We have, you know, some really amazing honorees we're going to have, and certainly look forward to participating, and hopefully those who are listening can come.
Well, great. And it's Start New York?
Yes, startny.org.
Right. Great if you want to get your tickets, right?
Please get it right away.
for the event. Well, thank you so much for sharing with us the great work that you're doing. I'm with you on, you know, those are some teary days when you're seeing what we're all up against.
But we're hopeful.
But we are hopeful.
We are hopeful.
And if you're dealing with 3,400 people a year, you are making an impact. And I hope you get to work with those small kids too. Right, because I do think that that's where
it is.
Where it is.
And we are excited about that.
Right.
We're almost there to launch that program, so we're looking forward to it.
Excellent. My sincere thanks to Jonnel Doris, former senior advisor to Mayor Bill de Blasio and CEO of START Treatment and Recovery Centers. If you know someone that can benefit from their service, contact their websites and download the CUNY TV app in your Apple Store or in Google Play and find us there. And that's it for us today. We thank you so much for joining us. We will see you the next time. I'm Carol Jenkins. The program is Black America.